There are 4 tests to do to look for athletic pubalgia, and since we're going to assess how the rectus and the adductors come in and attach at the same area, we're going to make those muscles contract. So the first thing we're going to do is a resisted sit-up. So my patient has a very heavy weight, so he's going to come up into a crunch position for me, and I'm going to be palpating his rectus to see if the pull of his rectus recreates his symptoms. The next thing I can do is I can have him fire his adductors, which will attach at the other end. So for this, he's in a hook lying position. I'm going to have him do an isometric resistance of his adductor. So go ahead and fire, Billy. And rest. Does that bother you?
Nope.
Okay. So now the next test, or the third test, is we're going to combine resisted hip adduction with resisted rectus contraction. So he's going to keep holding on to the weight and come into a partial sit-up, contracting his rectus while he's contracting his adductor. So go ahead and push into me and fight that. Okay, now come up into a sit-up position for me. So I can't palpate because I have my hands are full. Does that bother you at all?
No.
Okay. The very last test we're going to do is along those same lines, but instead of resisting hip adduction bilaterally, we're just going to do one leg. So Billy's going to do a straight leg raise, and he's going to externally rotate his leg a little bit. I'm going to be applying resistance right here. This will bias his adductors. So I'm going to apply some resistance here, Billy. Okay, good. Now come up into that sit-up again. And is that bothersome at all?
No.
Okay, so I'm pretty confident you don't have athletic pubalgia.